Welcome. Let's try to just refresh ourselves and begin the discussion for today. So this is going to be the first session. And from tomorrow, we are going to start with the exclusive dopamine drive program. So before starting with that, I just want to orient yourself how exactly you're going to travel for the next 160 days. Those who have attended already my last session, you would have got some idea. And if you haven't attended last time, now you are going to get the complete orientation, what we are going to do from tomorrow onwards. So take a moment, look at the participant count right now. Just 22. So every single person, 22 of them, those who have joined here, every single person who is joining with me today and sharing your digital space today with me, you all have the same target, August 30th, 2026. Every person here wants to take the top clinical branch, and every person here wants to make their parents proud. And let's be brutally honest. Every single of you had got the same subscriptions from the same applications throughout the country. And same massive question banks you have got. And the same old grand test. So let me ask you an uncomfortable question right here. If every one of you have the same access to that same resources, why do you all have only 5% of the students out of everyone those who are using that app is able to achieve that dream mark? I'm not talking about rank. I'm talking about the rank mark basically. Why only 5% of them can achieve that 600 plus mark, while other 95% are going to repeat again and again, work again and again, and tell excuses? Can anyone tell in the chat box? What is the reason? You, me, everyone use that same app, but we are not able to get that same mark like how the topper get, that top 5% get. What is the reason? Sai Vignesh is telling consistency and determination. Sheikh Rahat is telling no proper guidance. Niveda, strategy and consistency. Exactly. Two important things. What I want to tell you is the discipline, revision, consistency, as you told, mentorship. All these things are the one that plays a major role. Smart work. That smart work is something which is missing. So I'll tell you why. Because 95% of them operate on motivation. Let me tell you a story. A brilliant junior of mine from my internship days, let's call him Rahul, and he had very subscriptions like A app, B app, C app, everything he had. He bought iPad, color coded notes, beautifully decorated study table. He will watch always these motivation videos by the toppers in that favorite app, and he gets that hype and study for 14 hours at a stretch for the 3 days. And day 4, he gets exhausted. On day 5, difficult ward duty will be there. He will be not able to touch his books. Day 6, he will be scrolling his Instagram pages and feel incredibly guilty. He will think that no, I cannot do it. I am out totally. I am out of the competition. He decides it before even starting it. And what will happen? Rahul will fail to get his seat of his choice. It is not because he wasn't smart enough. It is because the motivation he felt on the day 1, he doesn't feel it on the day 6. And feeling fade when you are tired, hungry, stressed. But remember, the top 5% who scored that 1 to 100 ranks, they secured their choice of seat. They secured their choice of rank, not only because of motivation, but as you guys listed in the chat box, because of the determination to achieve that success by consistency and discipline, by consistency and strategy. So that is exactly why you are here today in the Dopamine Mentorship Drive program in the guidance of Dr. Vinayak Sir and myself. For the next 160 days, starting from tomorrow morning, you will be steered by me. That means I'm going to tell you the direction, like how the Google map tells you where you should go, what you should do, and how you should do it. I have done mathematical analysis. To be very frank, I have decoded the NBE examiner's mindset, what exactly they are going to ask you, how exactly they are going to ask you. I have decoded it, and your job is very simple. Wake up every day in the morning, execute the daily target I am going to give you blindfolded. Okay, that is exactly what you are going to do. So welcome to the Dopamine Drive program in the 2026. And if you are going to give me 160 days, ruthlessly, unbreakable consistency, I'll give you the rank that you expect, that you deserve. We are clear on this, right? Type yes in the chat box if you are ready to drop the excuses and follow it with a pure discipline. So that's exactly, that's energy is something that we need. And I acknowledge it. Okay, all right. So this is our target. Each one of you are going to be there, as I told you, in the top 100 rank. So it's going to be like top 100 rank, only the dopamine drive students. No one else can get it, because you are going to be trained in such a way that you will be able to solve whatever question that is going to be asked in the exam. And we are not going to go with 200 hours of lectures or massive question bank with lots of unnecessary things. We are going to curate the important topic, and we are going to list how many probability, how many different questions that can be asked from that particular curated topics. That means that curated topics is something they are going to ask you in the exam, not with something which is there in the 258th page of your favorite app's note. Never. That is not going to be the answer. You read thousands of pages of notes, that is not going to yield you mark. Why? I always tell, because it is not that you are not reading anything. It is that you are preparing like your university exam. You are preparing with thousands of pages of notes. When the exam is going to be very simple, they are going to test your ability to solve your MCQ. What you need to do? You need to solve MCQ. Sir, but how to solve MCQ? That's exactly what I'm going to tell you right now. Before that, I'll ask you one question. Can you tell me why you haven't attended your... So how many of you attended your GT and how many of you not attended the GT which we have kept yesterday? The diagnostic GT which we have created, which was meant to mirror your knowledge, existing knowledge. How many of you did it? Very good. Quite a few of you have attended it. Some of you wouldn't have attended it. No problem. We got only 30 responses. 30 students attended the GT. The remaining of them didn't attend the GT. Let's not talk about the remaining of them, but we will see how this is GT has done. So let's talk about the elephant in the room. Just a few hours ago at 2 o'clock, Kannan and my analytic team handed me over the complete detailed performance analysis of the 30 students who ever attended the diagnostic GT. I have the data right here in front of me. I told you this was a mentorship where you would be watched closely. You will be monitored closely. And when I told that in the last session, I meant it. So I am going to analyze every single GT that you are going to do. Now I have 30 students analysis. Same way I will be doing analysis for every single person, those who are going to attend the GT from today onwards. Let's look at the odd numbers. Out of the 170 enrolled, till now 170 students enrolled in the surge. Out of that, 30 have only attended. And out of the 30 also, if you see, only 27 participated completely. Upper highest or average when we take around 373 mark was average. This is like beautiful. This is like unexpected. So out of the 30 students, everyone stand above baseline. That means that everyone can improve their score up to 600 very easily. So I am completely happy about that. And accuracy was around 60.7%. That is again above 50%. So I am happy with that also. That is very solid. Honest baseline to start our 160-day journey. So first of all, I would like to publicly recognize the elite band. 5 of you crossed that 500-point mark. Alina Anthony, who scored around 630. Very good. Incredible work. Then Sagar, Kuljit Singh, Haripriya, and Nimisha, everyone achieved the target, achieved that elite bracket. So you can celebrate this tonight, but do not get complacent with a single second. The real war is going to just begin now. Next, I am looking that 14 of you are standing in the mid-range of 350 to 499. Shubham, Pranav Patel, Neha, Junath, Sayak Rahat. Everyone I have attended and got around 350 to 499. You guys are right in the absolute edge. You are just 6 and 7 correct answers. Just 6 to 7 questions. If you are going to make it correct, you are going to cross that 500 mark barrier. You have the foundational knowledge with you, but the negative marking and poor time management was slightly bleeding your scores. Our immediate target is to cross that 500 in the GT2. But looking at this data, I noticed a massive glaring issue that is present in the entire batch, the skip strategy. Let me give you a simple example. One of you had got 500 marks. Your accuracy was 78.8%. But the problem is you skipped around 30 questions. And with your accuracy that high, if you had attempted 30 more questions with your simple guess and elimination, statistically you would have stand 540 to 550 right now. And look at Subhashni, Sudharni, all these people, they skipped 38 to 37 questions. That is 20% of the entire paper. You have abandoned it. I can understand that. Pure fear of negative marking. But you cannot skip 40 questions blank. And you cannot expect top rank with that. So before GT2, I will be conducting a mandatory skip strategy workshop to teach you the exact mathematics, when to guess and when to leave a question. So that we will do. Is it clear, everyone? So now tell me, is skipping benefited, or in this case, the skipping has caused a loss of mark? Because her accuracy is around 78%. If she has attempted the remaining 30 questions, around at least 15 questions, there is a chance to get right. And that could have fetched more marks, around 60 marks, and that could have fetched the marks to 560. So here the problem is, we are having a fear that if we have attended and if you are going wrong, what will happen? But this is not going to be a real exam, isn't it? The real exam, this is not going to be a real exam, definitely. So what can be done from next time onwards is, we have 20 GTs in the next 160 days. For the first 10 GT, try to attend maximum questions. Don't skip. Even let it be wrong. Even let it be a mistake. No problem, we can correct it. But once you do a mistake, once you click a wrong answer, once you get a wrong answer and negative marking, that question will never go from your mind. Because you will always remember that this question I have made mistake. This question I have made mistake. That point is going to again and again come in your mind. So that is the best strategy. So will you be attending all the 200 questions for the next 10 GTs and try to make mistake? Don't fear to make mistake. Is it clear? Everyone? Everyone, are you guys ready to make mistake? Only if you guys are ready to make mistake, you will be remembering the mistake and try to correct the mistake next time. Clear? Okay. So the first problem we have is the fear of mirror. Let me address you the red flag. We have 4 people. Okay. Mandal, Vignesh, Shushil, Rishabh. These people started attending the questions. Okay. No problem if I name them. This mentorship session is going to be naming only. Once I'm going to call out you, next time you will not make this mistake. That is the ultimate aim, because there's a closed group with students, those who are going to be with the aim of getting the first 100 ranks. So don't worry, don't feel bad. This is going to be your stepping up for success. So just imagine these people started their questions in the GT. But the problem with them is, you opened the test, got overwhelmed and skipped around 180 questions. Out of 200, you're skipping 180 questions. Why did you do that? I know exactly the reason. Because you guys got terrified of the mirror of what you are and where you are standing. You are so scared to see the low baseline score that you intentionally sabotaged the test so it wouldn't count. You just skipped it so that it is not going to count. You are not ready to see where you are standing. When you are not ready to see where you are standing, how will you correct your mistake? Not only these 4, at least these 4 tried to attempt. What about the remaining 140 students, 130 students who are in the group? Why didn't you guys attend the GT? If you are not ready to see where you stand, how will you improve yourself? I am telling it right now, right here. You cannot hide in this mentorship. You cannot run from your reality. I will be scheduling mandatory one-to-one counseling session for each and everyone, those who are not attending the GT. I am very brutal in this. If you are not attending GTs, I'll be messaging from my team. The team will be contacting you individually to ask you the explanation of why you are not attending your GT, why you are not attending your schedules properly. Then only you will write your GT2 properly. Score a 10 marks, no problem. Even if you score 10 marks, not a problem. Randomly try to answer at least every question. Only then you will understand the concept. You must face the mirror if you ever want to improve in your life. My target for this batch is very simple. I want minimum 30 points, 30 score growth from one GT to another. That means that now you are in the rank of 320. Every third GT, your score has to rise 100 marks. That means at the end of 20, even if you are in 300, you will cross the 600 score and you will get minimum, mark my words, minimum top 100 ranks. It's easy to score the top 100 ranks if you are going to follow the schedule. But listen to me carefully. Before establishing the baseline today, I do not care about the raw score, whatever you have got in the diagnostic GT. Why did I force you to write the diagnostic GT, grueling 3 hours test before even opening the book, before even guiding you guys? The reason is simple. GT is the MRI of your brain's current state. The NBE examiner is not testing your ability to rote memorize the textbooks like how you are doing in your MBBS exams. They are testing your clinical reflex. For example, just let me know what answer you gave for this question. What answer you gave for this question? A 65-year-old man with an inferior wall MI. BP is 80/50. JVP is elevated, but crucially his lung is completely clear. What they have asked, what drug is strictly contraindicated here? Can you tell me what answer you all wrote? Nitroglycerin. Nitroglycerin. Very good. So what is the drug that is strictly contraindicated, they have asked? Very good. Many of you wrote nitroglycerin, isn't it? If many of you wrote nitroglycerin, isn't it? So, but some of you, I can see some of you are confused whether it is oral aspirin, whether it is sublingual nitroglycerin. Many people were confused. So what they have asked which is strictly contraindicated. The problem is when a patient presenting with the inferior wall MI, often due to the right coronary artery occlusion, they will frequently have a concurrent right ventricular infraction. They will also have right ventricular infraction. So this is what is the clinical triad of right ventricular infraction? One is going to be your hypotension. Okay, one is going to be your elevated JVP, and the people will have a clear lung field. Okay, is this everything there in your question? So the infracted right ventricle will become very stiff and they act as a passive conduit. Therefore, maintaining a cardiac output will be heavily dependent on the adequate venous return that is going to come in. Okay, so that is going to be coming in. Now, what happens in this question? We all, when we see this MI, many people have wrote aspirin also. Some of them also wrote this intravenous normal saline. Many people wrote intravenous normal saline also, as far as I can see in the results, whatever you have got. Thousands of students in the country, when I am going to tell MI, their brain immediately screams one mnemonic. Can you guys tell in the chat box what is that mnemonic? When you have this MI word, what is the mnemonic you are going to get? What is the mnemonic you are going to get? Come on. Everyone knows the mnemonic. Everyone, type in the chat box. Very good. Mona. Everyone will get that Mona mnemonic only, isn't it? Immediately in your mind. Morphine, oxygen, nitrate, aspirin. Okay. So this is exactly. So what happens is, so everyone knows that nitroglycerin is going to be the one that is indicated in MI. Aspirin, morphine, nitrates and oxygen. All these four are indicated in MI. So whenever they see an inferior wall MI, whenever they are going to see this word MI, everyone's mindset will be going like oxygen, morphine, nitrate, aspirin. All these four are given in MI. But the examiner knows that you all memorize these mnemonic. That's exactly why they gave you inferior wall MI with a clear lung. So this is a classical trade of right ventricular infarct. When the right ventricle is dead, your heart is going to act like a stiff pipe. The only way your blood to get into the left side of the heart is through a increased venous pressure, shear venous pressure. How to increase this venous pressure? If you give that nitroglycerin, what happens? It is a potent vasodilator. So it is going to decrease your preload. Already there is going to be a need for increase in preload whenever you have a right ventricular infarct. Now you give nitroglycerin, the patient is already having a venous pressure need, and now you give potent vasodilator, you drop their preload to 0. You will kill the patient right there in ER. So the correct answer is nitrates are absolutely contraindicated. Though in your MONA, you are not having normal saline infusion. You need to push IV fluids. Okay? You need to push IV fluid. That right there is the difference between reading the PDF, notes and various sources and cracking the NEET PG. The one who answered this correctly is the one that stands above 500. Because they use the logic, they tried first of all reading the paper. They read the question properly and they got the answer. So at this stage, I just want to discuss with you a very important aspect. What is that? I want to discuss with you a very, very important aspect that is going to be how to read. Yesterday, I got a numerous messages. Sir, I am reading pages and pages, sir, but I am not able to recall anything. What happened? I am not able to recall anything. What is the reason, sir? Why I am not able to recall anything? Very simple. We already know that reading is something that is different from what we think. It is not like just seeing the glance of papers. Reading means what? So you need to understand the message that is written in the paper. Without understanding the message that is written in the paper, if you're going to just go on skimming through the pages, what is going to be the use of it? Nil, zero. You won't be able to understand anything. So there are actually 5 types of reading basically. First, I wanted to tell you this. Okay, there you can skim through the page, you can scan, or you can extensively read. What you are doing? Are you skimming through the pages or extensively reading the pages? Because only if you're going to extensively read a page, you can understand. So that is why there is something called as SQ3R. There is something called as SQ3R method. Okay, what is this SQ3R method? S stands for first survey. Whenever you start, like for example, tomorrow you're going to start with the cardiovascular system. When you're going to start with cardiovascular system, first take a notebook and write what is going to be your objective for today. Only if you know what is the objective for today, you will be able to understand what all you need to complete today. Or else how will you know what all you need to complete today? So my job is, I'll be giving you all the topics, whatever you're going to read tomorrow. What you're going to do is take a notebook, write down those topics on the day, first page of your note, which you're going to put it tomorrow. Okay, once you put that, next is question. So next thing what you're going to ask is, what are the questions that is possible from this paragraph? So when you're going to start with, for example, tomorrow you're going to start with ECG and arrhythmia as a first topic. When I'm going to tell you ECG and arrhythmia, what are the common questions that are asked from the arrhythmia? What are the common questions that is asked from the ECG? So what you're going to do is, first you need to set your mind, set your mindset, what you have to read. That I'm going to give you a handout also. I'm going to give you a handout where I will list out all the topic that you need to write, you need to remember, you need to revise. Okay, so whatever source you have already been using, no problem, continue to use that. Along with that, you are going to start questioning whatever you are going to read from your respective sources. Once you survey by writing the objectives, then write the question, then read. Now is the first step. So first step, what you're going to do is you're going to read. So what is reading? Reading is basically nothing but after questioning, you're going to begin the actual reading where you're going to read the text. I read it once, understand everything. That attitude is totally a myth. Okay, you will never understand whatever you're reading at the first time. So you are just going to focus on what are the main points that are going to be there in this entire text. You have thousands of pages of notes, isn't it? But thousands of pages is not needed for your exam. So what you're going to do is, out of the thousands of pages, what is needed for your exam? What are the questions that are asked in the exam? What are the topics I have given to you? You're going to underline that and you're going to transfer it to the new note. Clear? Once you do that, then second thing is recall. So after reading, what you will be doing is, you will read pages for 50 to 60 pages per day, for example. At the end of the day, what I'll be doing is, I'll be giving you a MCQ test. So that MCQ test you are going to do. After completing the MCQ test, again you are going to recall. Whatever you are read on the entire day, you're going to recall again. Once you recalled the things, add on the points which all you missed and which are there in the MCQ. So now you got a revision of whatever you have learned from morning to evening. Then what we will be doing is, we will be reviewing it after 10 days. Not now. First 4 steps we are going to do each day. And after 10 days, a buffer day which we have kept, we are going to take that revision notes which we have prepared and we are going to read it. So that is going to be your review. So this is called as your SQ3R method. And I want you guys to follow this SQ3R method. Is it clear? Am I clear? Am I clear? Are you all clear with this SQ3R method? Will you follow that SQ3R method? SQ3R method. Will you guys follow? Yes. So this is a very fantastic method which you all are going to follow. Clear, right? Yes. So now, tonight, before going to sleep, I want you all to go back to the diagnostic GT, which we have done 2 days back. This is going to be the treasure map. After this session, I'll be sending you 2 things. After this session, I'll be sending you 2 things. Number 1, the schedule. Schedule will be shared to you. And number 2, I'll be sending you the Google form. So in the form, we have space for you to fill what are your strengths, what are your weakness, what is going to be your, what will be your action to overcome that. So that we call it a SWOT analysis. Once you do that SWOT analysis of yourself, you will be able to categorize your mistakes into 3 aspects. Number 1, blind spot. You simply never read the topic. Don't worry, we will cover it in the next 160 days. Sometime you would have done some silly mistake. That is, you would have not seen that word except. You will not see the word contraindicated. So we will fix that exam temperament by repeated tests which we are going to conduct. And finally, the trap concepts like this right ventricular infarct, even though you knew the theory, but you will fall into the examiner's trap. So that we will be able to make it right. So know your weakness today. So that is my important point. So know your weakness today so we can systematically destroy them in the next 160 days. Now coming to the 160-day strategy, what we are going to follow. Now let me show you the roadmap, how exactly we are going to travel for the next 160 days. So we will execute this using RRR protocol, which is my favorite naming. In fact, I am the one who got that name. I started this strategy for MBBS students and I was very successful with them. And I believe that this batch is going to prove that even NEET PG is a very simple exam where we can pass with this simple strategy. What you are going to do? You are going to categorize your entire preparation for the next 160 days into 3. Phase 1 is revision, revise. This is going to be the starting from tomorrow, where you're going to build your concept, build your foundation. For the next 77 days, you're going to dedicate yourself completely, no excuses, nothing, hardcore, disciplined, structured study, which we are going to do with, I have given you 8 days buffer. So in this 85 days, 77 days is going to be the time when you're going to study, and you have 8 more days buffer and GT I have kept on that. Then comes the refine phase, totally 50 days. Once your foundation is built, we will completely stop reading the subjects in isolation. We will not read by isolation. Very clear, right? So like how you need to read for your exam. Prepare for the MCQ. MCQ is not going to be differentiated like pathology, microbiology, forensic medicine. At least forensic you can. But then for medicine, for surgery, it is not going to be separated. Medicine, microbiology, pathology, they three are integrated. So we will go by integration in the next phase. That is going to be a phase 2. Integrated material also I am trying to make. I will make it definitely. And then finally going to the phase 3, where we will reinforce for the next 25 days, the last 25 days, no heavy textbooks, purely volatile visual memory, images, IPC codes, PYQ breakdown, all those things we are going to do. Clear, right? This is exactly what we are going to do. And your timetable is ready, very similar to this. Next slide, I will be showing you the timetable also. You can see it. Okay, so how the phase 1 is going to work for the next phase 1, 85 days. Yes, right? 85 days. How it is going to work. So it is not like your traditional coaching institute where we teach anatomy on day 1, physiology on day 2, pathology on day 3. It's not like that. We have divided into blocks. We have divided into blocks where we are going to teach you from most important to least important. Okay. And what we are going to do is we are going to revise it. So this is what we call it as V cycle. What is V cycle? It's a neurological sequencing. Look at the timetable. I have started with medicine. Okay. I have started with medicine and I have moved into psychiatry. Then we are moving into anatomy. Immediately after a short visual break of dermatology, we are going into general surgery, orthopedics, anesthesia. So what we will be doing is, we will have one foundation followed by one visual break, then major clinical subject. From following that, the surgical extension. This is how we are going to travel. And this is how the human brain will retain the complex information. If you are going to link everything together without isolating them, you will be remembering it easily. Okay, you will be remembering it easily. So this is how your timetable is made, which will be shared with you by next 15-20 minutes by Kannan or by Mohan sir. Okay, so your phase 1 starts on March 23. Those who have not yet joined with us, don't worry. We also have one more batch starting on April 1 with similar timetable with slight modification, which again Kannan sir will share for those who are going to join from April 1. Those who are going to join from tomorrow, you don't have a choice. You need to start from tomorrow. Tomorrow never comes. We always tell that, isn't it? So when you are planning tomorrow, make sure tomorrow you're going to start. Don't shift it. 1 day, 7 days are there for medicine, which is too high. Why can't I do it for 6 days and why can't I skip tomorrow? Don't do that. Every single day counts. So make sure you're going to work hard for every single day for the next 85 days. So March 23 is tomorrow. So how you will be starting is, first you will be starting with ECG basics, arrhythmia, heart failure. This is how we are going to do. First ECG basics, arrhythmia, heart failure. Then we will go with ischemic heart disease. Then we will go with hypertension, valvular heart disease. Then you will go for your infective endocarditis, rheumatic heart disease. All these you will be covering. So these are the important topics which we are going to cover. Nothing more, nothing less. And you're going to cover it like this in the same time. So 1 to 2, you're going to take lunch. 5 to 6, I'm going to give you a small break. 6 to 10, you will have. So at 10 o'clock sharply, at 10 p.m. sharply, you're going to attend the test, whichever is going to be present in the question bank. So there is a question bank column in your Dopamine app. If you're going to open your Dopamine app, you will be having a question bank. In that, every day, I'm going to post you with questions, 50 to 100 questions. So if you take CVS, we have 50 questions. But if you take CNS, I have prepared 100 questions for you guys, where 25 questions is exclusively I have prepared as IBQ, image-based questions. So you are going to attend that on everyday basis. Is it clear? Are you all clear with this timetable? So you are going to have a morning what you need to read, afternoon what you need to read, evening what you need to read. I have given you, I have just taken a spoon and fed you in spoon. That's all. I'm just feeding you, literally. I'm not asking you to prepare your timetable. You follow this timetable. That's all. You follow this timetable and you're going to win. That's all. Sir, source material. See, I'll come to that. I'll come to that. So again, this is how I have prepared. And on April 1, you are going to have your first GT. So prepare all your buffers, whichever present, whichever you have not read in the morning session of your April 1, and attend your grand test on the morning session of your April 1 and do analysis, and then start with anatomy. So then you will be moving into dermatology, then you will move into the surgery, then you will move into the physiology, and then anesthesia. So I have divided this physiology into part 1, then part 2, part 3, part 4. I have divided it separately. Then we have biochemistry, pharmacology, and then we have pathology. Then we have divided microbiology for 5 days, and pediatrics for 4 days, OBG for 6 days, PSM for around 6 days, Ophthalm for 4 days, ENT for 3 days, and radiology we have for 2 days. So I have given you the entire blueprint. I have given you the entire blueprint. Can an intern be able to follow this timetable? Yes, of course, everyone will be able to follow this. Okay, the problem is interns will not have time, but nevertheless, interns are going to give their first attempt. Try to follow this timetable. Try to attend the question banks. Try to attend the test, whatever we are giving you. And there is something called as dopamine surge. If you are going to see, open your dopamine app, we have something called as dopamine surge. That is actually the solution for interns. Sir, will you teach these topics? See, for teaching complete theory, the complete topics, we have the retreat program. So in the retreat program, what we did is, we have taken all the class, entire 19 subjects is covered in extensively. So we have covered extensively in the same format. From morning to evening, how you are going to study. From morning to evening, that is like if I tell medicine I'm going to give for 6 days, we have in our app under retreat program, day 1, day 2, day 3, day 4, day 5, and finally day 6. All this is like arranged in the same order. But of course, if you are not brought this retreat, or if you don't want to skip your source material, because you would have already read in some A, B, C and app, but I don't want to disturb that cycle right now. So if you want, you can go to the retreat app where we have given you the entire 19 subject video in the same order, which you can revise. No, sir, I don't want to change my theory basics, which I have read in my previous preparations. Never mind, don't change your source. You have something called a surge. Okay, where again 19 subjects is like covered in shorter time. We have covered the 19 subjects in a very short time. Okay, so that is going to be in 4 hours. You have OBG, 4 to 6 hours. You have medicine covered in 8 hours. Like that, we have completely shortlisted the important topics and we have discussed it in the MCQ manner, in the MCQ basis. You can go and see that. So we have surge videos as well as GMI video in this plan. No, sir, I already saw numerous videos. Now I don't want video. I want just guidance. That is what your drive is. So drive is nothing but just the guidance. I'm going to tell you what to read. You can follow from your source material, whatever you have. If at all you have difficulty, you can go to either this one or this one. But this is not compulsory for you guys. Try to follow the timetable what I am giving you. That is more than enough. Clear, right? So what we are going to do? How is this ecosystem is going to work for the next few days? So I want to talk to you about how we are going to test you, because testing is your weapon. Again, I am telling, seeing numerous videos or seeing numerous notes are not going to help you. So what we are going to do is, every evening, we are going to give you 50 to 100 MCQs. Strictly from what we have given in our timetable. That is, from morning to evening, whatever you have read, strictly those questions will be asked. Clear, right? Once that is done, then we will be having a custom subject-wise test. That is, once your medicine completely gets over, you will be given a custom subject-wise test with 100 MCQs. So when you are going to be given with 100 MCQ, that is directly designed by me. Remember, guys, nowhere these questions are present. Not in your ABC app or not in your ABC books. It is completely curated by me and the faculties who are there in Dopamine. So you can be very sure that these questions will not be available in any app or any books. So we are not copying like others. We are giving you a straight away new questions. I am building these to bypass your rote memory because by now you will be all memorized with your M app and P app questions. You will be like already memorized that. So my questions will force you to actually think. And you all know how was the questions when you attended this progress GT, which you have attended 2 days back. Then what we will be doing is, in the phase 1, you will have 1 GT. You will be having phase 1 GT for every 10 days. So this is going to build you stamina. We are not expecting you to get full marks or above 400, above 500, nothing. We want you to consistently attend the GT, have a notebook, track your mark, put a graph, track your mark, where you are standing. Okay, that is going to help you to identify the weak points, and the entire GT day is going to be left free. So you're going to memorize, you're going to understand the concept of those 200 questions then and there. And then we will move to the phase 2. In phase 2, you will be having GT on every 7 days. So in the phase 3, you will be having GT on every 5 days. So by the time you sit in the real exam hall on August 30th, your brain will be thinking like it is just another Sunday GT by Dopamine. You will not have that panic at all because you are attending GT regularly. So it is like just another exam for your improvement of score than the previous GT, isn't it? That's all. Clear, right? So by now, this brings me to the absolute core of this orientation. I can give you the greatest, most mathematically perfect timetable on earth. But if you don't execute it correctly on a random Tuesday evening when it is raining outside, you feel exhausted, you close your books, you go and have chai and start talking with your friends and leave your timetable, it means absolutely nothing. All the efforts I'm going to take for the next 150 days or 160 days is going to get wasted. So starting from tomorrow morning, you are all bounded by a contract, like a bond, literally like a bond. You are all going to write and give me a bond. Sir, is this student suitable? Is this timetable suitable for retreat questions? Because we are going on question basis. Yes, of course. Retreat is also question basis only, isn't it? So retreat is exactly designed by me with the needs. What is the need for the students? So you can of course follow that, because you are already trained such a way that day 1, day 2, day 3, day 4, and at the end you are going to revise together. So you are already designed like that. So you don't have to worry about that. For those who are not part of retreat, you are going to get trained now, but better late than never. You will be trained in this way. You will be trained in this way such that you will be able to attend. Okay, you will be able to attend. Clear, right? Yes. So now, if you're going to see, what we are going to do is very clear. Rule number 1, call it as 4 daily non-negotiables. Starting from tomorrow, you're going to be giving me a bond written and signed by you all. After clicking that Google form, after filling that Google form, it is literally like a bond. You're going to follow these 4 negotiables. One is single source. I always tell you, if you are already well versed, M app, P app, C app, whatever it is, I don't care about it. If you are already well versed with that app, pick that. If you are not well versed, pick dopamine, retreat, or surge. Surge is something I'll tell compulsory you need to have, because that is something where we are discussing how to solve MCQ. But for theory, for complete understanding of theory, how to solve by question, part by part, is what covered in the retreat. But I will not force you. You follow the primary source, be it M app, P app, D app, C app, whatever it is. I don't care, but marry it. Don't diverse it in the middle. I do not want you to download random 50 pages PDF from the Telegram in the May month because some senior said you that it is high yield questions. I had a brilliant friend last year who failed simply because he chased behind 10 sources and revised none. Because of what? Fear of missing out. FOMO. Because of this FOMO cancer, he lost in his preparation. So NEET PG is cracked by revising one single source 5 times, not by reading 5 different sources one time. And of course, what I can promise you is I will try to give you high yield points as a separate PDF every day. Now I have prepared for cardiology. I am preparing for neurology. I'll try to prepare and send you. If it is 1 or 2 days late, Please don't feel that why dopamine is not giving, because we are preparing with a very careful consideration that in your second phase, you can just go through that notes to fetch good marks. So in that way, we are preparing the next 85 days along with you. I am also preparing for NEET PG. That is how we are going to run. And in the next 85 days, at the end of 85th day, we will give you a beautiful compiled notes, which is going to have high yield points. Clear, right? Yes. Now the rule number 2 is daily MCQs. See, if you are attending from ABC source or not, I don't care. But every single person should attend the everyday 50 to 100 MCQ, which we are going to post it as a module in your question bank. And again, remember, these questions, these answers will also be assessed individually by our team. That means we will be giving you the orientation. We will be giving you individually the suggestions and feedback after your grand test, after your subject-wise test, after your daily test. So you are closely monitored by me and Vinayak sir. We are going to do that. So what you need to do is read your notes, comfortably sit, and then highlight and then write this MCQ. Because reading your notes is a passive one. It is a comfortable illusion, I will tell. You can highlight the entire page in the neon pink color, feel incredibly productive, close your books, feeling that everything you know, and suddenly you feel nothing is there in your mind. So how will you know that things are there in your mind or not? Every single evening, you must solve this 50 to 75 MCQs, which we are going to give you, and it is compulsory. And that is where you analyze the traps. That is where you will actually find where you are lagging. Then every day after that 100 question assessment, 20 minutes you are going to take and you are going to do a micro revision. So you have something called as Ebbinger's forgetting curve, which is actually biologically proven. If you study something today, you will forget 80% of it by 1 week and 60% of it by Thursday. Today I read something, by Thursday you will forget 60% and by Sunday you will forget 80%. How do we act this? You need to reinforce yourself. Every single night before you close your book, you will set a timer for 20 minutes. You will rapidly scroll through the pages you read yesterday, not today's page. So 20 minutes in the previous day, whatever you have read, that you are going to revise, not today's. So you will rapidly scroll through the pages that you read yesterday, not today's page, yesterday's. This is a very simple 20 minutes daily habit that is going to push all your short-term memory into long-term memory. So your retention is pushed from 40% to 85%. So don't dare to skip it. This is a very, very important one. And finally, end of the day accountability report. See, this is mentorship. I don't have the recorded video of you from morning to evening. Though I use this term, I am watching you. I'm not going to record you by keeping a camera, right? So before you sleep, whether it is 10 o'clock or 2 o'clock, drop a message in the group. Don't be ashamed. Don't be afraid of dropping a message in the group. Tell that, sir, I have completed the topics which you have given today. Sir, I haven't finished the things what you gave today. Even if you completed, not completed, no problem. So you're going to put a message like this in the group. Is it clear? For everyone, what you're going to do is, you're going to drop a message in the group like this. What is the message you're going to drop in the group? What is the message you're going to drop in the group? So target completed. So you're going to put a message that target completed. Not only that, MCQ. So I have completed all the 75, 50, whatever MCQ given. I have logged the mistakes. Okay, mistakes logged. This is going to be a message that I'm going to get from you, and then rapid recall, micro revision done. Micro revision done. So this is going to be a standard message which I want everyone to put it in the group. If you had a terrible day and only finished 50%, put it as target 50% completed. We'll carry it to the buffer day. You own your progress. You own your failures. When you see 100 of doctors posting the end of the day report at 11 o'clock, you will feel the physiological pressure, psychological pressure to sit back, finish your work, then go to sleep. Because you're part of the elite group, high performance unit, which is going to score top 100 ranks. Clear? You're going to score the top 100 ranks. Is it clear? So tomorrow is the March 23rd. Tomorrow is day 1 of your phase 1. we are not easing into this. We are launching straight into the heavyweight champion, general medicine. Sir, starting a general medicine, sir. Don't you help us with shorter subject? No. We will start with general medicine. I know that you guys are going to have some lag in general medicine that we will cover it at the end. No problem. But start with this general medicine. So tomorrow's target for you is, so what you're going to do is, tomorrow's target is very simple. We are going to start with the cardiovascular system. So what is your focus? Morning, you're going to start with ECG, arrhythmia, heart failure. Afternoon, you're going to talk about ischemic heart disease, valvular heart disease. In that itself, you will be covering rheumatic heart disease. Then you will go to endocarditis. Very simple, right? Yes. So listen to me carefully. Do not sit with your books 6 hours tomorrow trying to memorize the genetic mutation of every rare congenital cardiomyopathy. That is waste of your energy. I want you to be laser focused because the NBE loves your ECG interpretation. In ECG, what they are going to love? All your atrial fibrillation. Okay. And how you manage the atrial fibrillation. They will be giving you a ECG and they're going to ask you to find what is the type of atrial fibrillation which is going to be there. What is the type of arrhythmia which is going to be there. So you're going to identify that and what is going to be the drug of choice. They love the sequence of drugs which is present in the acute decompensated heart failure. They focus on algorithms, focus on the side effects of amiodarone, digoxin, etc. So immediately after this webinar, I am going to drop you this master timetable PDF on day 1. And along with that, tomorrow morning, by tomorrow morning, you will have this medicine handout, which I am going to provide you, medicine handout, which will be having the tomorrow's topic, that is cardiovascular system. So your handout is going to be something like this. It is going to start with the ECG. What are the things you need to read in ECG? Then it goes to arrhythmia. What are the topics that you need to learn in arrhythmia? Hyperkalemia, hypokalemia, what is importance? And then what are the types of arrhythmias you have? Supraventricular arrhythmias, okay, tachycardias, and what are the management plan for it, which is according to the recent guidelines. Then it goes towards the heart disease, ischemic heart disease, then valvular heart disease, what are the different sounds you have, and then we will also discuss about the endocarditis, etc. So this is how you are going to go. Is it clear? Are you guys enthusiastic? Will you guys able to do? So after this, before we sign off, I want to address the thought that is running through your head right now. I can hear some of your voices also. Sir, I have 12 hours of duty, sir. I am working as an intern, sir. I am working as a duty medical officer, sir. I am working in the hospital, sir. How can I possibly finish the medicine day 1? I am doing my internship. I am doing my work in a very high, heavy government setup hospital. How can I do this? Definitely, I know your pain. If you are on duty, your job is to adapt. You do your MCQ on your phone when you are waiting for a CT scan. You do some high yield PDF in the lunch. Do not aim at 100% perfection on duty days. Of course, aim at least 60% of execution. Something is better than nothing, isn't it? You are working in a government setup. You work in the government setup and you don't have time. But definitely something is better, isn't it? So now you have some material with you. You have some material of what to do. You have a plan with you. What you're going to do is very simple. Okay, very simple. What you're going to do is you're just going to go through all the topics that I'm going to give you when you are free at some time. Okay, va? When you are free at some time, try to do something that will help you to fetch mark. Who knows? You can get very good marks. You are already trained clinically. You are just going to revise whatever you are doing it in your hospital. That's easy actually. So don't get low when you think that, sir, I don't know if I'm going to do. Don't think negative. Whatever is possible, do. Give your 100%. The remaining God will take care. Clear? Then comes the next question. Sir, I did very good, sir. From morning to evening, I am reading, sir. But I couldn't score good in the MCQ. Good. I want you to score low now. I want you to make 40 mistakes every day. I want you to make 50 to 40 mistakes tomorrow. Every mistake you make in your room in the March, is a mistake you will not do in the exam in the August. Do not let your ego tie your self-awareness, self-worth, your self-esteem to practice a app score. Okay, va? So that is going to be completely different. Don't tie up with your ego. How can I get low score? And don't blame others or blame everyone that, sir, I don't get the material, I don't get this, I don't get that. Once you stop blaming, once you start to find solution, you will be able to successful. So tonight, I want you all to clear up your desk. Put away all the pathology books, put away all the surgery notes, keep only medicine in your table. Okay, just try no. And first 1 week, you will fail miserably. No problem. Even if you fail to complete all the topics, don't worry. You can follow the April 1 timetable. Not an issue. But don't keep it as an excuse. Try to attend all the MCQs whichever shared to you everyday basis. Okay, attend those MCQs. Clear, right? Tonight, I want you all to do this. And you have 160 days to change your trajectory for your entire medical career. 160 days of sacrifice to earn a lifetime respect as a specialist. When that alarm goes off tomorrow morning, do not negotiate with your mind. Do not hit snooze button, sorry. Do not hit snooze button. You wake up, you sit at the desk, you execute the task. So this is exactly what we are going to do. Welcome to Dopamine Mentorship, doctors. Let us not chase behind the mark or rank. Let us chase behind the knowledge. Let us chase behind our discipline. Let us chase behind our consistency. So consistency, discipline, both the things is going to take you to the height which you are not even expecting. That is going to be more than what your expectation is. So I'll be the first one who will be waiting for you to submit your end of day assessment reports. Every day I want this to be done. Preparing for NEET PG is an academic challenge. If you think that is totally wrong, it is not academic challenge. It is purely psychological. Students often begin this with high motivation, but they lose consistency in the middle with the fear of missing out, with distraction, with doubt, self-doubt, with fatigueness, etc. Our goal is to ensure that you are first consistent, you are first disciplined enough, then comes to the subject. Subject you can learn very easily, but to be consistent and to be disciplined is very difficult. So let us move forward together with clarity, discipline, and confidence. Okay, is it clear? Is it clear? So already your group, your shared with your dopamine drive mentorship schedule. So this schedule is shared only for the students, those who are part of our one-time one-to-one mentorship and retreat program, and those who are going to be joining with drive program. Okay, so try to follow this. Even if you are not getting your score, don't worry. You will get your score when you are staying consistent. And once you are consistent, once you are confident, then it is easy to success. So I have already told this in the group. I don't know how many of you read that message of mine in the group. If you have not read that message, again I'm sharing with you. See, the entire concept of NEET PG is very simple. NEET PG is all about the probability. So just imagine you're going to do 20 GTs from now on. Okay, so 20 into 200, which is going to be equal to 4,000 questions, which you're going to do. And along with that, every day you're going to be shared with minimum 150 MCQs for the next 160 days. That is going to be roughly around 8,000 questions. Along with that, you are going to be having subject-wise test, which is going to contain 100 into 19, which is going to be 1,900 questions. So this itself roughly comes around 13,900 questions. Along with that, you are going to be added on with your search videos. So that is going to be add on another 1,900 to 2,000 questions. Okay, and again you will be having GMI, which is going to be again another 2,000 questions, which is going to be roughly around, okay, 17,000, correct, 900, which is going to go to 18,000. Along with this 18,000, what we are going to do is we are also going to discuss some MCQs then and there, and that is going to be roughly coming around 1,000 MCQs. So 19,000 MCQs you are going to attend, and this 19,000 MCQ is something apart from this, nothing can be asked in your exam. So this itself comes around roughly, you're going to see 78,000 topics. Each question has 4 topics in it. So totally 78,000 topics. About 78,000 probable questions, you're going to cover it in the next few days. And if you are going to cover this with utmost confidence, with utmost dedication, what else can be asked in the exam? Who is going to defeat you? You guys are going to be in the top 100 ranks. I am very sure about it. Sir, unable to see the result of GT. Okay, fine. From now on, we are just trying to sort out the question. This what to tell. We are trying to sort out this GTs and test material. We are also trying to bring in some other platform where we can actually help you with attending the questions very similar to that of your NEET PG platform, NEET PG screen. So we are doing that in background. So till that time, what we will do is we will upload that in our notes section. So we will be uploading the answers and the question paper in the notes section of your app. So inside the app, we will upload it in the notes section. So we will do it. Sir, won't you teach us? See, that's what I told you again. See, teaching needs more hours. If you're going to see roughly, if you want me to teach the entire 19 subjects, I have to start from day morning to evening. I have to sit with you. That we have already covered in retreat program. So retreat program is something we have already covered that same way. So there you can go and see. Sir, how to see which question I made wrong? Okay, fine. So that's what I'm telling Pranav. We are working on it to make sure that you will know where you made wrong. So you will know your what is the right question and wrong question, what all you attended right and wrong. That you will be getting it soon. And I will also try to upload the question paper in the app so that you will be able to listen. See, now only we are also trying to develop our app to the needs of the students. Okay, so we will develop it, but that is not going to stop. See, stopping you from doing your work, that cannot be hindered by the simple technological errors. We are going to give you with all your material. You can actually go through and read it also. That's not a problem. But then before in the next 2 weeks, we will try maximum to make sure that your testing app gets fine. Your testing thing gets integrated. That we will do. No problem. Rajiv, again, I told you, right? So go to the retreat. If you want retreat, all 19 subject recorded video in the same way it is there. So not at all a problem. You can read it. So that is not a problem. Clear, right? If you want, no, sir, I don't want to know the complete aspects. No problem. Go to Surge. Surge is much more cheaper in the rate also. And see, our pricings are not something that is very costly because we have kept it in such a low range because we want the NEET PG to become accessible to all. At the same time, we have not kept 1,000 hours of lecture like other platform have. So even in retreat, if you see, we have curated the material such that what is needed for you, you will be learning it. What is not needed for you, you're not going to touch it. So that's how we are going to do. And more you solve your MCQs, which I'm going to give you, that itself will be better. That itself will be helpful. And Rajiv, if you are a part of Surge program already, you already have 2 videos, that is Dopamine Surge and Dopamine GMI. Surge topics and GMI's topics are not same. Surge has some topics and GMI has some topic. Try to read that along with this schedule. That will be helping you. Is it clear? Any more doubts? Any more doubts you have? Now the forum is yours. Now the forum is yours. I want doubts to be asked right now. Sir, my path and pharma basics are weak. It will be difficult to study medicine first without my... See, it's not like that. This is a problem which we all have. What you do is, there is nothing distinction between path, pharma and medicine. Medicine, it's going to be integrated. So start with your medicine itself. See, you are all past your MBBS. So you all think that you are not very strong in these subjects. But believe me, you are strong in the subject. Medicine does not need full understanding of path and form. Medicine is a separate domain where you need to integrate path and form accepted. But the basics of path and form, that is general pathology and general pharmacology, is not needed here. So whatever you know, you try to read. We are anyway going to integrate at the end. First 85 days is going to be just first phase. In the second phase and third phase, you will be able to integrate properly. So you have ample time, 8 days. So whatever required here, you read. It is not difficult. I am assuring you. Medicine is not difficult without knowing the path and form separately. Path and form, here also you see, very simple logic, I'll tell you. I am allotting you heart failure, I am allotting you 1 half day. 1 half day I am going to allotting you for cardiac failure or heart failure. Pathology, you have read heart failure. Pharmacology, you have read heart failure. When you read in path and form, why to read medicine separately? Instead, you read medicine first basics. Something, whatever there in your notes, whatever there in your existing material, try to understand that. When you go to the basics again in the path and form, you will be able to recall whatever you have learned in medicine, and that will strengthen your medicine. So that is why I kept like this. Sir, usually it takes long time for me to review any GT I give. I also feel just giving through and question in GT is not very useful. Rather going through the topic from which the question is asked what I do. But it takes lot of time even to review one subject. See, it will be helpful once you start reading. Arjun, Arjun, I'll tell you very simple, Ra. It is anyway, GT you're going to give now just for understanding where you stand. So you are going to go through daily topic wise only. So for example, if you take the timetable which we have for tomorrow, okay, you are going to anyway have like heart failure, ischemic heart disease, and you're going to have hypertension, valvular heart disease, and you're going to have your arrhythmias and valvular heart disease. All these things are there tomorrow. So you are not going to go do GT now. First, you start with these topics. And at the end of the day, you're going to attend the daily MCQs. So in that, what you make mistake, again you go through the previous questions which you have already attended today. GT பொறுத்தவரை, if you're going to see, April 1, you're going to have the next GT. GTN, you're going to attend it in the afternoon, 2 to 5:30. After that, what you're going to do, from 5:30 to evening you have. You're going to take 200 MCQs. 200 MCQ, now you should be thorough with medicine and psychiatry. So your first aspect has to be, in this GT1, I should get maximum mark in the medicine and psychiatry because I have already scored it. I have already studied it. So make sure that you are reading that. Once you going to read that, go back from your MCQ towards these topics. That will be helpful for you. Okay, once you are going to do that, then subsequently, as the day progresses, you would have read the topic and you will be attending GT. That time it will be like reducing. The time you take to revise your GT will be consistently reducing. On the last day of your revise first phase, you will not take much time to revise your GT like you did on the day 1, that is your April 1. So just follow this, you will be able to succeed. Don't worry. Now you will have lots of questions. Once you start doing it, you will be able to. Sir, I will try to complete your handout daily, sir. In addition, I'll complete surge video. No, pa. Surge video at the end of medicine, day 7. You should complete the surge videos and GMI video at some point of time. Take some point of time and complete the surge and GMI video. That is compulsory for everyone. Those who have the video access. Those who don't have video access, fine. Those who have video access, you need to complete surge and all your GMI videos. Second, handout is only supplementary. Handout is only supplementary. Remember carefully. Nothing can replace. So many people can actually advertise that you read this only you will get success. I'm not going to tell that because that is a false commitment which can be given. Handout is the important points that can be asked in the exam. But it is like only 70 to 80% accuracy. The remaining 20% they can ask you from anywhere. So you need to follow the complete notes which you have daily. Okay, which you have prepared daily before. If you don't have, that means you are starting from scratch. No worries. Try to do at least the search videos for now. And then read the handout, attend the MCQs. From the MCQs, again, you will be getting the questions answer. From that answer, again, you will be revising the concept and it should be going like a viscous cycle. Clear, right? So I think some of you might know me from my college days also. You are always welcome to message me. That is not a problem. The handout I have given already to team. They are just aligning it and they will post it. So don't worry. And also remember guys, I am doing it just now. So I am just started to do the handout. Since you guys asked me, I am starting to do because handout is not something I have promised in the mentorship because many of you told that you are not having the proper material also. That is why I have started to do it. Sometime it can delay also. But remember guys, I will try to maximum give you materials. Maximum materials I try to give you. Okay, sir, is there any target strategy curated for May 26 UNICET? I'll try to put a separate video next week how to target your UNICET along with this. I'll definitely do that. So what I will advise is you in between the time try to complete all your Surge and GMI videos. Probably GMI video is more oriented towards INISET, but specifically INISET target, I'll put a separate video. And in between, I will also try to take sessions, maximum 3 to 4 days once I'll come live, because I also have my clinical duties. I am also having my own patients. So all those I have to see, but definitely you are one among my commitments. So definitely I'll be coming online. You message me anything in the group by tagging me, than personalized message, because sometime DM I will be missing it out, but in group I will never miss it. So message, sir, through this GT I understood I lack precision. Example, important triads. How about to go this? Yeah, that's exactly what I am telling. Now, as you start attending your GTs and MCQs, you will know where you are going wrong. So when you are going to read daily these topics, you have to focus those things. So what will be asked in the exam? See, for example, if you are going to read this ischemic heart disease, okay, if you are going to read ischemic heart disease, for example, tomorrow you are going to start with the ischemic heart disease, or you start with, for example, you start with your hyperkalemia itself. When you start with hyperkalemia, what you need to understand in hyperkalemia? In hyperkalemia, you want to understand that at 5.5 to 6.5 milliequivalent per liter, you will be having a tall peak, narrowed, based tent like T waves. This is the earliest sign. Then prolonged PR interval, then widening of QRS complex, then very wide QRS complex with T wave terminating with a sine wave. So these 4 points are something that is important. Rather than going with all the points, this 4 is something they ask in the exam. And how do you manage this patient? So how do you manage this patient? Take a separate note, write it down as a flow chart. 10% IV calcium gluconate. That is the first thing I'm going to give. But this is not going to lower my serum potassium. It is going to antagonize only the membrane effects of hyperkalemia. So what I'm going to do next, I'm going to give IV regular insulin and 50% dextrose. Why I am giving? I wanted to activate the sodium potassium ATPase pump. After that, what I'm going to do? I'm going to give beta 2 antagonist like salbutamol, which is going to synergetically act. What are all these medication going to do? It is going to shift the potassium intracellularly. And once it is going to shift the potassium intracellularly, I am going to give IV sodium bicarbonate as a concurrent to prevent what? To prevent severe metabolic acidosis. Then what happens? Now I have pushed all the potassium. Now I wanted to excrete the potassium out of my body. For pushing the potassium out of my body, I wanted to activate what? The kidney to push all the potassium outside. I am going to make my kidney to push outside by giving diuretics. What diuretics? This is where the concept lies. There is going to be a potassium that is going to be excreted in the loop. So it's a loop diuretics which you need to give. That is your furosemide. Then what you need to do? You need to do in the gastrointestine. You can actually push the potassium by how? Cation exchange resins. What are the resins you have? Sodium polystyrene sulfonate. So this can be given. Or if nothing is going to work out, it is going to be a refractory case, or if it is going to be a renal failure case, I am going to go for hemodialysis. Clear? This is my pathophysiology. This is going to be my treatment option. Clear, right? This is how you need to learn. Once you read like this, you will be able to understand easily. Is it clear? And what you need to remember in hypokalemia? Only 5 points. Prominent U wave. And what you are going to do? IV calcium, potassium chloride you are going to give. But the problem is maximum infusion rate is 10 milliequivalent per hour. That is the trap. That is where they concentrate. And along with that, what you need to do? Magnesium level should be checked. Why? Hypomagnesemia prevents potassium repletion. Hypomagnesemia, if it is there, potassium cannot be repleted. So potassium, if you wanted to increase, then magnesium has to be corrected. That you need to remember. Clear, right? So this is how you need to go forward. Then coming to arrhythmias. So tomorrow you're going to have various arrhythmias. First is the atrial fibrillation. When you're going to have atrial fibrillation, start like this. Introduction. What you need to learn. Then go with the etiology. Hypertension, most common. Ischemic heart disease, valvular heart disease, thyrotoxicosis, alcohol binge drinking, aging. All these are the causes of arrhythmia. Then what happens basically? So what happens? What happens in arrhythmia? What happens in AF? What is the main reason for the atrial fibrillation? Don't think too much. Just think why there is going to be atrial fibrillation. Just imagine you are just running into the heart. You are just standing in the muscles of the atrium. What happens in muscles of the atrium to become very hyperactive? It gets more signal, isn't it? So your atrium gets more signal. When your atrium gets more signal, what happens? When your atrium gets more signal, from where? Normally it has to start from SA node. Normally it has to start from SA node. But what happens? It is not starting from SA node. It is starting from ectopic. When it starts from ectopic foci, now your question to be asked. That's why I told when you are reading, it has to be like this: survey, question, read, revise, refine. Okay, this is how your things should go. SQ 3R. So once you surveyed it, next your question has to be there. Okay, this ectopi, where is this ectopic present? Where is this ectopic present? This is going to be present in the atrial tissue. Where it is going to extend? It is going to extend into the pulmonary vein. So because it is extending into pulmonary vein, this is going to cause wandering into the recurrent wavelets present in the atrium. Because it is going to be wandering around, the AV node is bombarded with hundreds of impulses per minute from outside. And that is going to act as a filter, transmitting the impulses directly into your ventricles without any proper coordination, irregular rate. So that is exactly what is atrial fibrillation. Now, once you understand this, it will be easy for you. Okay, it will be presenting with what? When your heart is going to be pumping faster, palpitation is going to be there. When it is going to be fast pumping is going to be there, it does not allow the blood to adequately enter into your heart, adequately enter into your various organs. So you will have dyspnea, you will be having fatigue, you will be having precipitation of acute heart failure. And what are the complications? Sometimes your blood is going to get stasis in the left atrial appendages, and that is going to cause stagnation. When something gets stagnated in your blood vessel, that causes thrombi. When thrombi is going to be there due to the pumping of heart, it is going to cause emboli and it leads to stroke. Simple, right? This is all about your clinical features. It took me 5 minutes now to explain you. It takes 10 more minutes to understand. Now what happens? Because of irregular pumping of irregular impulses that is arising from your atrium, the P wave, which is actually signifies the atrial systole, right? Atrial systole. What happens here? There is no atrial systole because very irregular. You have fibrillatory waves, your P waves are absent. Your P waves are replaced by fibrillatory waves with the irregular pulse rate, RR interval. And then what happens when you're going to see in echo? You will be seeing any valvular heart diseases there. Again, I told you left ventricle may get failure. So you're going to see left ventricle ejection fraction. And then what you're going to do? You're going to see when any thrombi is there, emboli is there, you're going to see. And finally, you have to move for the management. In management, what you need to do? First, you need to control the rate, you need to control the rhythm, and you need to prevent the stroke. Of course, because it can run out, isn't it? So you need to prevent your stroke. And that is exactly the management protocol. Is it very difficult now? The one I told you. The one I told you, is it very difficult? Then comes the supraventricular tachycardia. Then AVNRT is going to be there. Wolff-Parkinson syndrome is going to be there. Ventricular tachycardia and ventricular fibrillation is going to be there. Then what are the drugs you are going to give? Antiarrhythmic drugs, amiodarone, class 3 drugs. It is going to contain iodine. But what is the problem? Because iodine is going to be there, it can deposit in your cornea. It can cause blue-gray skin discoloration, hepatotoxicity. Since it is going to cause hepatotoxicity, you need to look for LFT. Since it can cause thyroid dysfunction, you need to see TFT. Since it can cause pulmonary fibrosis, honeycomb lung, it can cause. So you need to see PFT. Now coming to the digoxin. Digoxin is helpful in the arrhythmia, but what is the problem with it? So it can cause what? What is the problem? You're going to read like this. With this, your arrhythmia comes to end. Then you go to the heart failure. So already you guys learned in your medicine, pathology, you guys passed, you guys you're coming and sitting here. So once you start, you ignite, it will be like getting. If you are not igniting yourself, it is very difficult. So first put a ignite. First, start your engine. Once you start your engine, probably for a few days, you will be running only with few kilometers. But once your engine gets accomplished, once your engine gets it's going to get what to tell. Once it is going to start functioning in the way you are, then it will be like purely success. So what I want you guys to do is, come on, with my speed, with my energy, with my passion, you are also going to run. If you are going to do that, you will be successful. Next 160 days, we are going to do this. We are going to successfully complete this, and I want you all to completely occupy the first 100 ranks. Believe me blindly, that's what I will be telling. If you're not believing me, you give yourself time, but the days are going to get down. Already you guys are having only 160 days. This is not a time to trial. I am telling you that this is going to become successful. If you are still having fear of missing out, now the choice is yours. You can decide. Those who are going to become consistently, those who are going to attend this consistently, those who are going to sit with me consistently, once you get the good rank, when these 30-40 people, when they get good rank, the remaining 140 people will be feeling they should have done that. Then they can come again, sit with me again next year. That's all. This is the very blunt truth I am telling you all. You believe me, you are not going to believe me, that is up to you. So let's do this all together. So the 30 or 40, those who are attended today, you guys are going to be in the top 1 to 40 ranks. Believe me, but you have to maintain the same enthusiasm for the next 160 days. Once you're going to do, you will be successful. Clear, right? Thank you all. Thank you so much.